Hi, so I'm going to be going over the subcutaneous and intramuscular injections in this video. So I could start by telling you what spots we do the injections. So for intramuscular, we do on the deltoid. You want 2 to 3 fingers below the acromion crest. For the vastus lateralis, you want it the palm of your hand on the greater trochanter. You want it a hand's width or hand's length below it, and a hand's length above the knee in between that area. You also want it in between the midline to outer midline of the thigh. You can do it on the ventrogluteal, which again, you want your palm on the greater trochanter. You want your thumb pointing towards the patient's groin. Your index finger going down the superior iliac crest with your middle finger in a V shape, and you want to do the injection in between the two. For subcutaneous, you can do it in the ventrodorsal gluteal, the thighs, the abdomen, the scapula, or the deltoid. The lateral posterior arm. And so we can go ahead and get started on the checkoff. If you want to, first things first, always wash your hands. After you do that, you're going to check the patient's MAR. So we have Miss Anna Pavlovsky. For Miss Anna, we're going to be giving her the influenza vaccine intramuscularly, and the subcutaneous would be vitamin B12. Influenza is going to be 0.5 milliliter. Subcutaneous is going to be 500 micrograms. So you're going to review the entire chart, locate what you need, and then you're going to go to the med cart and get your medications. So I only have one vial currently, but I'm going to, for the sake of this video, I will be pretending it's by 2 different vials. I'll be telling you, so this is going to be my B12 I'm going to draw up. This is going to be my influenza vaccine. So once you get it out, you do want to check the expiration date. And also, if it is a new vial, you want to label it with your time, date, initials. This is also when you want to look at your notes about the vaccines and what assessments you may need to do. So, for example, for influenza vaccines, throughout the after the administration, I want to monitor for any allergy reactions, such as rash or wheezing. But specifically, before, I want to know if the patient has any egg allergies. And for vitamin B12, I want to assess the blood pressure of the patient because vitamin B12, an adverse reaction, is hypertension. And so basically we can just get into it. Again, I would label the medication, my time, date, and initials. It's new. All right. So here is the vial. Awesome. All right. So now I'm going to gather my supplies. My kid's going dark. I'm sorry. So I have my 2 syringes. I have my 25 gauge 5/8 of a length for subcutaneous injections, and then my 22 gauge, inch and a half. I want to apologize that there is the tape on them. I didn't want to take it off because I did not want the numbers coming off with it, but I'll go on pretending they're not there. First, I want to calculate the dose. So for influenza vaccines, it's 0.5 milliliter. The influenza comes in milliliter vial, so there's really no calculations needed there. But for subcutaneous, it's 500 micrograms. Now the bottle for subcutaneous B12 would be 1,000 micrograms per milliliter. So in order to give the patient 500 micrograms, we have to give them 0.5 milliliter. So both are going to be 0.5 milliliter of medication. So yeah, once again, I'm going to select my items. My labeler, pencil, alcohol pads. All right, so I'm going to do my second check here. This is where I make sure the patient, make sure this is the right medication, right drug, right dose, route, time, patient, and documentation. And so I'm going to get for both B12 and for subcutaneous and for influenza vaccine. I'm going to wash my hands. So first I'm going to be doing the B12 injection. So I'm going to rub the top of the lid. I'm going to wait for it to dry and take off the. I need to wash my hands first. I always wash your hands before you do anything. Wash your hands. Wipe off the top of the lid. You're going to open it. And I'm going to pull in 1/2 milliliter of air. I'm going to inject air to air into the vial. And I'm going to flip it over and pull in 0.5 milliliters of medication. And if there's any air, I need to flick it out, inject it back in. Pull until it's 5 milliliters, or 0.5 milliliters, I'm sorry. All right, pull it back out, and aseptically, we're going to put the lid back on. There that is, awesome. All right, and I'm going to do the same thing for the other one. I'm going to, my 6 rights, which is right drug, dose, time, patient, right drug, dose, time, patient, route, and documentation. Oh yes, after I did this, I needed to put a label on it. I need to do it with my initials, the patient's name, the time, date, drug, and dosage. And this one, so again, we're going to clean the top of the vial. It's going to be for the influenza vaccine, the intramuscular injection. I'm going to take off, like the rainbow, pull in 1/2 milliliter. All right, and we'll inject air to air. I'm going to pull that. Oh, it's a big air bubble. Sure. All right, so we're going to put the air. Pull back. 0.5. All right. Over. And also aseptically put it back on. Then for this one, I would also do the time, date, my initials, patient's name, medication, and dosage. All right, now I'm going to gather my necessary supplies, which are my syringes, my gloves, my gauze, and my alcohol pads. I'm going to knock. Hi, my name is Laura. I'll be your student nurse today. I'm just here to give you your, can I have your name, date of birth? Do you have any allergies? And then this is where you're going to assess the environment, make sure they're in a safe place, the bed's locked, side rails are up, call lights within reach. You're going to make sure the patient's comfortable. You're going to close the door, close the curtain. And then you're going to educate the patient while you're there. You're going to tell them, so I would tell them, I'm here to give you your influenza vaccine and vitamin B12. The influenza vaccine causes the production of antibodies against infection from the influenza virus. And then for B12, it's going to correct any vitamin B12 deficiency the patient may have. I'm going to, at this point, I will monitor their blood pressure. I'll make sure the patient doesn't have any egg allergy. I also may tell them to look for any allergic reactions, such as like runny nose, rash, wheezing, right? And then, so after this, I'm going to scan the medications in. Once I scan them in, I'm going to do my third medication check, which is right drug, dose, time, route, patient, and documentation. I'm going to put on my gloves. And then this is my arm. So I'll be doing the subcutaneous one first. I'm going to I'm going to sit the patient up so I can see their access to their deltoids easier. I'm going to cleanse the site, so I'm going to start alcohol swab, inward circular motion, inwards to outwards. And then I'm going to pinch wait for it to dry. I'm going to pinch their 2 layers of skin and then dart it. I'm going to inject slowly, pull it out. At this point, I would engage the safety, but I'm not going to for this because I do only have a certain amount of supplies. I don't know when I'll be needing it again. Apply light pressure with the gauze. And then we can move on to the intramuscular one. So we'll be doing the alcohol pad again. I'm going to, again in the deltoid. I'm going to start circular motion inward to outwards. I'm going to wait for that to dry. Pull it apart. This is where I'm not going to put my hand directly across the injection site. I'm going to do it sideways, an inch and a half out. I'm going to dart it. Slowly inject. And I'll leave it in for 5 to 10 seconds. Alright, pull it out. And again, this is where I would engage the safety. And I would put the syringes in the sharps container, get rid of any medical waste. Apply the gauze on the patient lightly. So this is, I would get rid of any medical waste I have. And then I would document any assessments I did on patients, such as their blood pressure. I would also assess the environment, make sure the patient is comfortable and safe. Check the side rails are up, collides within reach, bed is locked, lowest position. At this point, I would wash my hands and open the door or the curtains. Right, and that's it. Thank you.